This is the manual muscle test for the anterior fibers of the deltoid. The start position, the patient is sitting, the arm is at the side with the shoulder in slight abduction and palm facing medially. The therapist will stabilize the scapula and clavicle. The movement, the patient will flex the shoulder to 90 degrees, simultaneously adducting and internally rotating the shoulder joint. Palpation is anterior aspect of the shoulder just distal to the lateral 1/3 of the clavicle. The resistance is applied on the anteromedial aspect of the arm just proximal to the elbow joint, and the resistance direction is shoulder extension with slight abduction and external rotation. So as seen here, you're resisting proximal to the elbow joint and pushing straight down. This is the manual muscle test for the middle fibers of the deltoid and the supraspinatus. So the start position, the patient is sitting with the test arm at the side in neutral rotation and the elbow is extended. The therapist will stabilize at the scapula. The movement, the patient will abduct the arm to 90 degrees as seen here. The palpation of the middle fibers of the deltoid is inferior to the tip of the acromion and the supraspinatus is too deep to palpate. Resistance applied proximal to the elbow joint on the lateral aspect of the arm, and you will resist shoulder adduction. So shown here, you stabilize it there, provide resistance just proximal to the elbow joint, and you're pushing straight down and trying to push them into adduction. And that is the middle fibers of the deltoid and the supraspinatus. This is the manual muscle test for the posterior fibers of the deltoid. The start position, the patient is prone, the shoulder is abducted to 75 degrees, the elbow is flexed to 90, and the forearm is hanging vertically over the table. The stabilization, the therapist will stabilize the scapula. The movement, the patient will horizontally abduct and slightly externally rotate the shoulder. The palpation is inferior to the lateral aspect of the spine of the scapula. The resistance is applied on the posterior lateral aspect of the arm proximal to the elbow joint. You resist horizontal adduction and slight internal rotation. So as seen here, stabilize at the scapula and then push straight down. This is the manual muscle test for the subscapularis. The patient, start position, the patient is prone, the shoulder is abducted to 90, the elbow is flexed to 90, and the arm proximal to the elbow is resting on the table. The therapist will stabilize the humerus to prevent shoulder adduction. The movement, the patient will internally rotate the shoulder by moving the palm of the hand towards the ceiling. The subscapularis is too deep to palpate. You resist on the proximal to the wrist joint. As seen there, struggling a little bit. There you go. This is the manual muscle test for the infraspinatus and the teres minor. The start position, the patient is prone, the shoulder is abducted to 90, the elbow is flexed to 90, and the arm proximal to the elbow is resting on the table. The therapist will stabilize the humerus to prevent shoulder adduction. The movement, the patient will externally rotate the shoulder by moving the back of the hand towards the ceiling. Palpation, the infraspinatus is over the body of the scapula, just inferior to the spine, and the teres minor is not palpable. And that is the infraspinatus and teres minor. This is the manual muscle test for the latissimus dorsi and the teres major. The start position, the patient is in prone lying position at the edge of the table. The arm is at the side with the shoulder in internal rotation. The palm faces the ceiling. Stabilization is provided by the weight of the trunk, and the therapist stabilizes at the scapula. The movement, the patient will extend the shoulder through full range of motion while maintaining slight shoulder adduction. Palpation of the latissimus dorsi is lateral to the inferior angle of the scapula or at the posterior wall of the axilla. The teres major is on the posterior wall of the axilla lateral to the axillary border of the scapula. So as seen here, stabilize at the scapula, resist on the wrist, and pushing straight down. This is the manual muscle test for the pectoralis major. The start position, the patient is supine, the shoulder is abducted to 90, and the elbow is flexed to 90. Stabilization is provided by the trunk, and the therapist stabilizes the contralateral shoulder. The movement, the patient will horizontally adduct the shoulder through full range of motion. Palpation, the pectoralis major sternal head is on the anterior border of the axilla. The clavicular head is inferior to the middle of the anterior border of the clavicle. The resistance is applied on the anterior aspect of the arm proximal to the elbow joint, and you will resist horizontal abduction. So as seen here, stabilize the contralateral shoulder, and you're trying to bring them into horizontal abduction. This is the manual muscle test for the coracobrachialis. To start position, the patient is prone, the shoulder is in slight abduction and external rotation. The elbow is flexed with the forearm in supination. Stabilization is provided by the weight of the trunk. The movement, the patient will flex and adduct the shoulder while maintaining the shoulder in external rotation. Palpation of the coracobrachialis is proximal 1/3 of the anterior-medial aspect of the arm, just anterior to the brachial pulse. The resistance location is applied on the anterior-medial aspect of the distal humerus, and the resistance direction is shoulder abduction and extension. So as seen here, you bring them up and you try to break them out, and that is